Individual. Growth, a stage, a condition, or process of increasing, developing, or maturing. Development, a process that creates growth, progress, positive change, or the addition of physical, economic, environmental, and social and demographic components. Individual, a single human being as distinct form of group. Individual, a single human being as distinct form of group. Individualization, to adapt to the needs or special circumstances of an individual. Socialization, the activity of mixing socially with others. An individual is a person with unique identity, may be similar to siblings but not exactly same except in case of twins. One individual is particularly different from other one and have his or her own needs or goals and likewise functions in society. Humans are social animals and cannot live in isolation, but being an individual, the structural and functional unit of the society are studied separately. Growth. It is a physical change and increase in size. Its size it can be measured quantitatively. Indicators of growth include height, weight, bone size, and dentition. Growth rates vary during different stages of growth and development. The growth rate is rapid during the prenatal, neonatal, and infancy, adolescent stages, and slows during childhood. Physical growth is minimal during adulthood. Rules of growth. Growth is a continuous and orderly process. Growth pattern of every individual is unique. Different body tissue grow at different rate. Development. It is an increase in the complexity of function, skill, progression. It is the capacity and skill of a person to adapt according to the environment. Development is a behavioral aspect of growth. Then we have rules of development. Development is a continuous process. Development depends upon the maturation of nervous system. The sequence of attainment of milestone is same in all children. The process of development progresses in cephalocaudal manner. Developmental is proximo-distal direction. Certain primitive reflexes have to be lost before attainment of relevant milestone. The initial disorganized mass activity is gradually replaced by specific and willful actions. Then we have stages of growth and development. Infant, infancy. The period from 1 month after birth till 1 year of age is termed as infancy, and the baby in this phase is termed as an infant. This is a period of rapid growth. When the baby is born, she is completely dependent on the mother and family members. But as a child grows, the dependency gradually decreases. The child starts recognizing the care provider and learns the basic social behavior in infancy. The milestones of development are usually classified into three categories: motor, language, social, and emotional. Infant shows the emotions of jealousy, love, and affection, stranger anxiety, and anger. Some of the milestones of the infant are: the infant holds the neck 3 to 4 months. Sitting with support 5 to 6 months, sitting without support 6 to 8 months, stands with support 8 to 10, stands without support and starts walking by the age of 12 months. The birth weight triples and length increases by 50% with respect to the birth weight and length respectively. Then we have the toddler. The child in the period from 1 to 3 years of age is called toddler. The growth is relatively slower in this period as compared to an infancy. The most important event of this phase is toilet training, bowel and bladder training. This age is prone for accidents and the toddler needs independence also that further predisposes him for the injury. The restrictions and overprotection of toddlers should be avoided as it increases the dependency in later life and toddler may not like to be restricted. Preschool child. The child from 3 to 6 years of the age is called preschool. Along with the increase in height and weight, the child's cognitive ability also increases and the child becomes more attentive. The informal teaching is initiated from home, therefore, the home is also termed as the first institution. The child is commonly cooperative and sympathetic at this age. School going child. This is a phase in which a child not only receives formal education from school but also learns from the society and the family, such as how to behave in a group, the expected and unexpected social behavior. They identify the individuals and peer groups of same sex they learn through either trial and error or by competitive spirit. Then adolescence. Adolescence. The period of physical, physiological, and psychological transition is known as adolescence, and the individual is termed as an adolescent. This is a phase in which a child enters the adulthood, the important event. If adolescence is appearance of secondary sexual characteristics such as breast changes and initiation of menstruation, menarche in females and masculine changes in males. Adolescence feels like adults and tries to mimic the actions of adults in behavior and do not want others to consider him or her as child. He she feels free and wants to explore every single thing. Therefore he she needs a good guidance. He she prefers to take decisions by themselves and may not like the interference of parents in his her life. On the other side, parents may have ambivalent and conduct related problems with adolescents. Then comes young adult. This is a phase of life of an individual in which he attains the physical and psychological maturity. Adult is full of energy, enthusiasm, innovations, and ambitions in life. Adults establish new family relationships such as marriage and form their own family, and they are no more dependent on their parents and earn their bread and butter by themselves. The understanding problems with parents resolve marriage is significant even in life of an adult. Middle age adult. Life again starts changing in terms of responsibilities of the family. Certain psychological and physical changes are again evident, such as decrease in basal metabolic rate and cognitive function. Individual plans for later adulthood, such as retirement plan or investment plan. Elderly or later adulthood. Individual assumes the responsibility such as head of the family. This phase starts with the retirement from the job. People experience certain changes in this age such as loss of memory, diminished vision and hearing, less interest, loss of self-confidence, considering oneself worthless and weak. There is increased risk of injuries and infections in this age. However, mental problems like dementia is also very common. Factors affecting growth and development. Prenatal factors. Genetic factor makes maternal factor. Then we have neonatal, intrauterine growth restriction, prematurity, prenatal asphyxia, perinatal asphyxia, postnatal nutrition, infectious disease, environmental toxins, acquired injury to brain, psychosocial factors, violence and abuse, maternal deprivation, protective factors, breastfeeding, maternal education. Then we have effects of social environment on human growth and development. Race and ethnicity, genetics and heredity, sex, socioeconomic status, family size, nutrition, hormones, environment, socialization process. Socialization is a lifelong process which starts at birth and continues till death. It is a socialization process that help an individual make this transition adapt to the changing environment. The process of socialization includes the elements and agencies of socialization. Social order is maintained mainly by the socialization. If the individual does not have in accordance with the norms of the group, he disintegrates. The process of socialization starts long before the child is born. The social conditions prevailing at the time of birth lays down the kind of life she has to lead. The parents' courtship, the customs concerning the pregnancy and birth, and the whole system of cultural practices in the family are important for the child's growth. Direct socialization begins after birth. The reflexes act as a barrier in the socialization process as they are innate and unavoidable. Sex instincts are the sources of the human endeavors which further explain the human behavior. Urge is a dynamic force behind behavior. It is the beginning of the social process. Incentives help to determine the capacity of human beings as there is no limit to human capacity. It is determined by the need and the motivation which comes from the incentives. Then we have imitation, learning by acting according to seen behavior, and identification of self and others is very important step in the process of socialization. Language is also one of the important factors of the process of the socialization. Then we have stages of socialization. There are three elements of socialization: physical and psychological. Environment and culture. Stages of socialization: oral stage, anal stage, Oedipal. Stages of socialization: oral, anal, Oedipal, latency, adolescence. It is a stage which begins from birth till child is of first 1 year. It needs to be fed as it is helpless and dependent on others for its very survival. During this stage, a child learns that one cannot totally depend on the mother for everything. The child realizes that there are some things that it must do it by itself. The child undergoes toilet training, acquires other skill. Oedipus, in this stage, the child becomes a member of the family as a whole. The child learns to identify itself with the social role described to it on the basis of its sex. According to Freud, the boy develops the Oedipus complex and girl develops Electra complex. Freud said boy develops Oedipus complex, boy, and the girl develop Electra complex. Okay. And then the latency stage, by the beginning of this stage, the child learns to be independent in the daily routine at home. She learns social norms. Adolescence, this stage starts with the onset of puberty and continues through the teenage years. This is a stage of transition from childhood to maturity, during which new patterns of behavior are learned to meet the increased demands of the peer group and of adult society. Adolescents learn new roles, behavior patterns, and internalize new social norms. The process of socialization from oral to adolescence is primary socialization. This is primary socialization.